Good morning, ma'am. Good morning, my dear friends. As a part of my case presentation, today I want to discuss with you all about depression, like case presentation on depression. In the sense, the person who is suffering from the depression, about their signs and symptoms, about their medical history, about their surgical history, and about the depression, like medications, everything will be about the physical status and about the mental status of the person. Okay, everything we'll discuss in the case presentation on depression. Okay, first and case presentation on depression. First, I would like to know about the history. See, when the patient is admitted in the psychiatric hospital, so okay, now first and foremost thing is, as a nurse, as a psychiatric nurse, we should we need to collect the history from the patient. Okay, because to history is the important thing. Without taking or without collecting history from the patient, we cannot do any nursing interventions to the patient. So that is the way even we cannot identify which diagnosis or which disease condition the patient is suffering. So the first thing is, as a nurse, we need to collect the history from the patient. Okay, the first we'll see the introduction about the case presentation on depression. So here the introduction, like as a part of my clinical posting, I was posted in psychiatric hospital, the psychiatric ward. I took the case of Mr. Raju. Age is 36 years of old, and he was admitted in the hospital on 2nd 1 2020 with the chief complaints of feeling of sadness and hopeless and pleasure in activities. Okay, then the mood swings and excessive crying and social isolation and irritability. Okay, so by knowing these all the symptoms, signs and symptoms, even the doctors have diagnosed as a depression. So I took the case of depression to provide a comprehensive care for my patient. Okay, here the introduction got over, then we'll see the patient profile. Okay, the patient profile, how, what is his lifestyle, what are the his marital status, everything, the patient profile. So the name of the patient is Mr. Raju. The age of the patient is 36 years of old, and he is a male, and the IP number is 1800, and the unit or ward is OPD psychiatric ward, and the education is he completed his intermediate and he stopped his education. The occupation is musician, and the monthly income is 5,000, and he is a Hindu religion background. The date of admission is 2nd January 2020. The diagnosis is a major depression. The address of the patient is Karakaram, Bhuvanagiri, Yadadri district, and the date of care which has been started on 2nd 1 2020. The date of care was ended in 4th 1 2020, then 2 2020, and informant, who is the informant here, in the sense who is giving, because the patient already is a depression patient. So whichever information or whichever history we want to collect from the patient, he cannot give accurate information, or he cannot say the accurate illness or whichever the complaint. So that is the way we need to take always for all of the psychiatric patients. Even one informant should be there to collect the history. So here the informant is his wife, because he is already married. So I took informant as his wife. So the reliability is true. Okay, then we'll move on to the chief complaints of the patients. Okay, what are the chief complaints of the patients? Means according to the clients, when I ask the client, so he is telling the symptoms he feels sad, and he feels irritated, and he is tired at times, and he have a difficulty in sleeping. Okay, when I ask the informant, like wife, when I ask him, according to the informant, he is having suicidal tendency, right? And he have difficulty in thinking, and he lost his interest in daily activities. Okay, so the duration of illness is from 15 days. Okay, the duration of illness is from 15 days. Then we'll move on to the history of present illness. Okay, what is the present illness of history? Okay, here the time of consent is like December, time of consent is here like 2/1/2020 at 2:40 p.m. and symptoms in the chronological order. Here the patient feels sad, irritable and suicidal thoughts and difficulty in thinking. Then what is the reason for hospitalization here? In the sense, like due to elevate symptoms, they were admitted in the psychiatric hospitals. Duration of illness is 15 days. Then next we'll move on to the medical and surgical history. Okay, present medical history and present surgical history, present medical history, present surgical history, past medical history, past surgical history. Okay, here present present surgical history, in the sense like actually the Mr. Raju is having present surgical history. Why? Because he met with an accident 15 days back. So he had a head injury, he had admitted in the hospital with the cheap complaints of headache and bleeding. So doctor given treatment of injection of diclofenac, BD 2 ml and injection of ibuprofen, OD 2 ml and tablet naproxen, BD 200 mg. Then what is the past history? In the sense, here now there is no past surgical history of the patient. Then what is the present psychiatric history? Here the present psychiatric history is like Mr. Raju was admitted in the psychiatric hospital on 2/1/2020 with the precipitating factors of head injury, and the informant and the patient given a complaints of feel sad, irritable, suicidal thoughts, and the doctor diagnosed as depression. So he is under treatment of for depression, they are providing treatment like sertraline and citalopram. Okay, sertraline is 100 mg BD, and citalopram is 100 mg per BD. So what is the past psychiatric history? The past psychiatric history, in the sense here the patient is already he met with an accident, right? So he had some symptoms the first episode of illness was started in the client at the age of 36 years of age, because in the same year he met with an accident. Due to the head injury, he had a changes in his brain, and there will be a damage had been occur. That is the way he has shown some symptoms as depression. So in the same year only in the 36 year of age only he met with an accident. In the same year he has diagnosed as depression. So the first, when he met with an accident, so he got admitted in the Sunshine Hospital. Okay, there the person is having symptoms of there he developed the symptoms of depression. He started the symptoms of sadness, irritability, and he had a severe headache and all. So thereby the doctors has referred to the psychiatric hospitals. There they diagnosed the symptoms. There they diagnosed by seeing all those symptoms, by complaining symptoms, everything they diagnosed as depression. So after admitting in the hospital, they were providing continuing of treatment sertraline. The sertraline and sertraline and citalopram, these all are the antidepressants to relieve or to reduce the depression. They'll use this type of drug. So now at present the patient is under the treatment. Okay, then the next one is family history. Okay, next we'll move on to the family history. As well, the family tree, you all know how to draw the family tree and who are the death, what is the keyword for patient, what is the keyword for death, what is the keyword for patient. Okay, then what are the keywords for illness, everything you all know, right? So then the family history. After that we'll after family tree, then we'll move on to the family composition. Okay, here the family compositions, in the sense who all are the involving in the family. Okay, 3 generations actually we supposed to see. Okay, from the grandfather, father, and the patients. Okay, actually 3 generations we used to see in the for all the family history. In the family composition, we'll see the one generation, patient generation, in the the name of the family and age or sex and relationship with the family, relationship with the head of the family, then education, their occupation, then income, and their health status. Okay, here the name of the the name of the family members names is the patient name is Mr. Raju, because he is the head of the family for this generation. So he is the head of the family. He is a male and 36 years of age, and his education is intermediate, and his occupation is musician, and his income is 5,000 per month, and his health status is unhealthy because he had he is suffering from depression. Then the next one is like wife, like a Mrs. Sunita. Then the age is 29 years of age, female, and the relationship with the head of the family is wife. Then her education is 5th class, and occupation is housewife, and there is no income, but her health status was good. Then the Mr. Abish is the son of the patient. He is having 13 years of age, male, son, and education is 9th class, and there is no occupation is he is a student. There is no income, but his health was good. Then the next one is Miss Monica. Monica is a daughter of patient. Then she's having 10 years of old, and then her education is 5th class, and her occupation is student. Then there is no income, but health status was good, healthy. So these are the comes under the family tree as well as the family composition. Then we'll move on to the personal history. Okay, Dr. Raju, who is suffering from the depression. Okay, what is the family personal history? Okay, what is the personal history of the patient? Here under the personal history, okay, I would like to discuss about the sleeping pattern of the patient. Okay, his sleeping pattern is 4 hours per day. Then his exercise pattern is he is not doing any exercises, but appetite is loss of appetite. Then diet pattern is he used to eat 2 times per day. Then hobbies, or he used to communicate with others friendly. The habits are he does not having any smoking or any drinking habits. And hygiene is okay, he used to maintain good hygiene. Depression, he's having poor dressing. His dressing style is poor dressing style, and like his personality is by showing him the he feels like anxiety and depression. There is no allergies, and the relationship with others, like he had good communication with others, but after depression he had suspicious towards others. Okay, then the next one is we'll move on to the socio-economic history. Here the socio-economic history, here the monthly family income is 5,000 per month. Then the breadwinner of family is husband, as he is a patient. Then the source of income is musician, and the financial status is poor. The type of house is pakka house. It is the own or rented, means it is the own house. The facilities whichever we observed in the patient's family, in the sense there will be a presence of ventilation is there, the good electricity is there, drainage system has been there, and proper lighting there, and water facilities also good, and disposal and rat facilities also available. Then there will be availability of district hospitals, and there will be availability of markets, temples, school, and as transportation. Okay, these are comes under socio-economic history. Then we'll move on to the perinatal history. Under the perinatal history, the patient Mr. Raju, who is diagnosed with the depression, his perinatal history is prenatal, intranatal, and postnatal. What do you mean by prenatal? In the sense before the pregnancy, intranatal during the delivery, and postnatal is after the delivery. Here the perinatal, during pregnancy, the immunization during pregnancy is TD at 5th and 9th month, and there is no radiation has been done. Then the drug pregnancy, during pregnancy, which drugs his mother has taken, in the sense calcium tablets, iron tablets, and as well as the folic acid tablets. Okay, these are the medications the mother has been used. Then the next one is intranatal history. Okay, during the delivery time, what will happen means the mode of delivery here is normal vaginal delivery, and the birth weight of the baby is 2.5 kgs. It is normal. Then the next one is postnatal history. The postnatal history here, in the sense the patient underwent a developmental milestones of the body. Okay, he had a good developmental milestones. Then the next one is we'll move on to the childhood history. Here the childhood history, how after delivery, how the baby was. Okay, then here the baby is the child, right? So how the child was, breastfeeding, like breastfeeding is 30 minutes of for 30 minutes. The mother used to give breastfeeding of 30 minutes. The age of weaning, when the weaning started in month of 6th month. Then the history of maternal deprivation, there is no maternal deprivation has been done, then occurred. The developmental milestones, well developed milestones had for patient. Okay, then the next one is like age of toilet training, when he started toilet training in the month of 18th month. So he don't have any childhood problems like stuttering, stammering, like enuresis, escaparesis, night tremors, or nail biting, or thumb sucking, or head bending, or temper tantrum. So there is no childhood history for that. There is no he don't have any childhood problems. Okay, then we'll move on to the like play history of the patient. Okay, how his play, how his play life. Okay, is the kind of play is rough and tumble play, and the peer relationship with the play is he had a good playmates. Okay, peer relationship, he had a good playmates, and he had a good relationship with the like social and primary group people. Okay, then the next one is educational history. After play history, then we'll move on to the educational history. He is a average in the academic, he is a average student in the his academic. Okay, then the next one is menstrual and obstetrical. There is no nil significance of menstrual and obstetrical history because he is a male. Then occupational history, here the occupational history is the age of starting the job, like he started his job at the age of 17 years. This job satisfaction is he used to start satisfied with his job, and he had a relationship with the peers and subordinates happily. He used to mingle with his colleagues and all. Okay, the next one is like we'll move on to the sexual and marital history. Okay, when he married, in the sense the age of marriage is 20 years. Actually, he started his job life at 17 years. He got married at the age of 20 years. Then he had a sexual relationship with the partners. Good, he had a good sexual relationship with his partner, and there is no marital conflict. So there is no disturbances with the wife and husband relationship. Okay, this is the sexual and marital history. Okay, then the next one is premorbid personality. Here the premorbid personality, in the sense here like we'll see like interpersonal relationships, like then use of leisure time, predominant mood and attitude towards self and others, attitude to work, responsibilities, religious beliefs and moral attitudes, fantasy life and habits, and coping with stressful events. These are all the things which are involved in the premorbid personality. Under premorbid personality, like here we would like to see interpersonal relationship. Here the patient, after diagnosed with the depression, so he had a suspicious behavior towards the family, friends and with the community, and he had a lack of interest and in the daily activities, and he is having the social isolation. Okay, he wants to be alone always, so social isolation also he had. Then use of leisure time. Okay, the client is not interested in any activities. If there is a leisure time also, he is not at all using that leisure time because he cannot show any interest towards the activities. Then the next one is predominant mood. Here his mood completely depressed, and he had a lack of interest. He had a like always he has to have a excessive crying and lack of appetite. Okay, that is comes under predominant mood. Then attitude towards self and others. How his attitude towards himself and towards others, how his attitude. Client have introversion, suicidal thinking and suspicious behavior towards other, and he had a stubborn attitude towards the others. Okay, then the next one is attitude to work or responsibilities. How he is having any responsibilities or he wants to do any work. Okay, he is depressed, so he cannot do proper work, and he don't have any good communication with others, and doubts among the group, and lacking responsibilities. Okay, for taking responsibilities he is lack in taking responsibilities, right? Okay, that is comes under attitude to work and responsibilities, because he is already depressed. That is why he cannot show any interest to towards the work, and he don't have any, if he not doing any work, he don't have any responsibility, automatically lack of responsibilities. Then religious beliefs as well as moral attitudes. Okay, what are the religious beliefs, or what are the moral attitudes he can maintain? Like, lack of religious beliefs he had. The patient Mr. Raju had a lack of religious beliefs, and because due to depression, and moral values are so less. Okay, because he is suffering from the depression, so he might have previously, but now he is not at all having any like religious beliefs, and there are no moral values. Then the then what are the habits he has a what are the habits means, like, he used to he has a fond of food and enjoyment with friends. Previously used to have like that. Then what are the coping with stressful event? When there are the stressful events occurs in his life, how can either he had a coping abilities, either he can cope up with that from the stressors or not. Like, he has an ability to cope up with the struggles and family stress, like economic and all. Okay, he had a good like a coping mechanics, like, he can cope up with the struggles. If there is a problems occurs in the family, he can easily cope up with that problems. Okay, that is. Then after getting diagnosed with the depression, like, he might lost some of the coping strategies. Then the next one is, like, the second one is physical examination and systemic examination. You please remember, like, after collecting the history from the data, like history from the patient, so the next foremost thing is doing a physical examination or systemic examination on the patient. Okay, because when the patient says it's okay, like, we can listen, even inform says also we can, but when we do the physical examination or systemic examinations to the patients, as a nurse, if you do on the patient, like, then you can understand clearly, even whether whichever they have said, is that there is a relation or not, correlation or not, we can identify. So for all, not only the psychiatric patients, even those who are admitted in the organic disorders also, our duty or responsibility is to collect the history, then collect the physical examinations from the patient, because this is one type of diagnostic procedure. After collecting history, after doing diagnosis, physical examination, systemic examination, only we can identify the patient who is actually which type of disease he is suffering. Okay, the physical examination and systemic examination. Under these, we, like, the first one is general appearance. Okay, how his looks. Okay, how his physical appearance or general appearance. Okay, by seeing him, his consciousness is conscious, and orientation is well oriented. Like, body oriented means he is supposed to be oriented to the place, person, time, environment, right? So he is oriented to well oriented, and body build is thin body build, and his attention is dull and depressed. Then vital signs. What are the vital signs? This is always for all the patients, we as a nurse, we supposed to check or monitor vitals like BP, temperature, pulse, and respiration. So the patient's temperature is 99.6 degree Fahrenheit. The pulse is 74 beats per minute. The respiration is 18 breath per minute, right? Then the BP is 180 by 90 mm of Hg. These are the vitals. Then anthropometric measurements. How we'll take, like, height and weight. Anthropometric measurement. His height is 156 centimeters, weight is 56 kgs, because he is a thin built person. Okay, then integumentary system, how the skin looks like. Okay, the skin color is good, the texture is dryness, the lesions, there are no lesions has been presented on the skin. Then the moisture is good. Then rashes, there are no rashes are present on the patient. Then hair and scalp, like, hair and scalp, like, the distribution of hair is equally distributed. Then the thickness is good, hair thickness is good, the scalp also good and white. The nails, here the nails, okay, nails, like, nails palette are shaped, and texture is good. The color, high pink in color, nails color is pink in color. Then the next we'll move on to the eyes. Visual activity, eyes, related to the eyes, how his eyes means, his eyes are normal, visual activity is normal, his position and alignment is normally adjustment. then the eyebrows are symmetrically, eyelids are normal, the pupil is like reacting to the light. When we expose the light into inside his eyes, he is reacting to the light. The ear is hearing is abnormal because sometimes he couldn't able to hear, so he had some problem. So there are no discharges has been presented from the ear. There are no another abnormalities have not found. Okay, then the nose. Okay, what is the nose here? In the sense, like in the patients, like infection, there are no infections has been present, absent. Like nostrils, there are no inflammation in the nostrils, patient's nostrils. Okay, then the mouth and pharynx. In the mouth and pharynx, in the sense, the lips. First we'll move on, first start with the lips. Lips are normal, there are no deviation. The teeth equally distributed. The gums pink in color, there are no gingivitis, and the tonsils not found. Okay, then the neck. We'll move on to the neck. How the neck is? Lymph node. The neck lymph node are not palpable, and carotid pulse is normally distributed, and thyroid gland is normal. Then we'll move on to the thorax and lungs. Here the thorax and lungs is, here we need to hear the lung sounds. Lung sounds are normal and clear, and the respiratory rate is 16 beats per minute, and any abnormalities in the sense, like there are no abnormalities has been found. Okay. The next we will move on to the cardiovascular system. Under cardiovascular system, what we'll see the heart rate of the patient. So heart sounds are clearly audible, like S1, S2 sounds are can be clearly audible. Okay, then we'll move on to the abdomen. If coming to the abdomen, in the sense, we need to identify 4 things in the abdomen, like physical methods, physical examination method, like inspection, okay, palpation, auscultation, and percussion. You all know the 3 things in the BSc nursing itself, and as fundamental of nursing, we can identify these all the 4 things. Like inspection means observation, like any skin changes has presented, or any rashes are presented, like how the body abdomen has been distributed, symmetry or symmetrical, or like everything we need to check in the observation or inspection. Then comes to the palpation. When I palpated on the patient's abdomen, there is no organomegaly. Okay, there is no enlargement of the organs on the stomach, inside the stomach. Then the auscultation, when I heard with the stethoscope, the normal bowel sounds I could hear, normal bladder sounds I could hear. Okay, then the percussion. Okay, when we do the percussion, tapping with the fingers, there is no ascites means fluid formation in the abdomen. There is no ascites has been found, and there is no pus formation. Okay, then like next we'll after auscultation, percussion, then we'll move on to the genitourinary system. Here the genitourinary system, like here we need to identify dysuria, polyuria, oliguria. Dysuria, in here the dysuria is absent, like dysuria in the sense, like then means lack of urination. Then polyuria means increased urination, that also absent. Then oliguria, lack of urination, that also absent. Then like in the genitourinary system only, then any prostate gland is enlarged, means there is no enlargement of the prostate gland. Then we'll move on to the rectal examination. Under rectal examination, there is no enlargement in the rectal region. Then we'll move on to the musculoskeletal system. Under musculoskeletal system, okay, the posture and gait. Okay, here the posture as well as the gait is normal. Then range of motions are good. Then muscle tone is present. Then the next one is neurological system. Here the mental status of the patient is depressed. Okay, our patient is feeling sadness and irritable. The central nervous system became abnormal because of due to depression, because he met with an accident, right? Then memory is okay, somewhat he had a good memory. Balance is like maintained body balance, okay, effectively. Okay, these are the comes under physical examinations of the Mr. Raju, who is diagnosed with the depression.